Hello, everyone. Welcome to the Pathways to Family Wellness podcast. My name is Dr. Brendan Reardon, pediatric and family chiropractor. And joining me for a second time is Chantal Traub. Chantal, thanks so much for joining us.
Thank you. I'm so excited to be here and
Yeah.
looking forward to our conversation.
Yeah, so excited to have you again. We had a chance to have a conversation for the podcast that was released about the principles of polyvagal, the polyvagal principles, which is really cool. But you have another incredible skill set as well, and that's pelvic health and the pelvic floor and being a birth doula. So let me read your bio and then we can jump on into it. All right.
Okay.
Chantal Traub is a seasoned birth doula and educator who speaks often on the subject of pelvic health for birth, safe and effective pushing, and protecting the physiology of both birthing mom and baby. Find her pushing power workshops and one-on-one birth coaching at chantaltraub.com. Chantal, good to have you here.
Thank you.
Yeah, absolutely. Now, if you can give us a little bit of a backstory about how you got into birth work yourself and how you even started on this topic, because I find it so interesting. So if you could share that, that would be great.
Yeah, how much time do you have? No,
Yeah,
just
right.
kidding.
Yeah.
Let's see. I started, I kind of came into the birth world through teaching yoga. So in the mid 90s, I was in a different profession before that, but I had
hmm
always been teaching yoga on the side. And in the mid 90s, when I moved to New York City, I was teaching yoga, but I kind of got invited to teach prenatal yoga, and prenatal yoga wasn't as popular then as it is now. Now there's like a prenatal yoga studio on every corner, like next to the coffee shop. But
Yeah.
in those days, there just wasn't. And because I had training that I'd actually taken out in California when I had been living, because I was first living in California before I moved to the East Coast, I got invited to teach prenatal yoga. And while initially I was like, oh, I love my, vinyasa mixed classes, I wasn't so sure I wanted to just only teach prenatal, but there was so much work offered.
hmm
Um, I was teaching these prenatal classes and then got invited to teach other teachers how to teach prenatal. So I was very much part of that kind of growth of prenatal yoga, and it was through my students who would invite me to their births because they felt that I was, helping them get comfortable in the classes and helping build confidence for the birth, and they would please come with me to my birth. And I was as my doula, and I was like, well, what's a doula? And
Yeah.
so I decided to take the doula training more to
hmm
deepen my knowledge, not thinking I would become a doula, but just deepen my knowledge to be able to better help my students in my classes. And through the training, I was so inspired. It was such an incredible training that it really resonated with me that moms needed support, especially in the hospital
Mm.
system. Um, and by the time I had audited, my 6 births for certification, I had connected with a couple of OBs and midwives who just started referring to me, and that kind of snowballed. And I never really looked for it. It felt like that profession kind of picked me, if you will. And
Sure.
it's just been such an organic process. And before I knew it, I was, back-to-back births. Um, this was like 23 years ago.
Wow.
Uh, yeah, and I love assisting home births, of course,
hmm
and birthing center births, but I felt like a real need for strong, solid support within the hospital system because that's where moms really needed, like their inner circle protection and just,
Yeah.
so much of that. So it's nice to do a blend, I assist
Yep.
births, in different
Yeah.
landscapes, but
And then how did you
but
get
I'm
into the
excited.
pelvic health side of things?
Okay, so I was a few years. So at the same time that I was a doula, I was also a childbirth educator, and I got certified through, both childbirth educators of
hmm
Metropolitan New York and through Lamaze, International.
hmm
And when in those days, this is like already like it's kind of getting into it the same time that I was becoming a doula. They didn't really spend too much time on pushing. It was kind of like you know when to push, like basically
Mm. Yeah.
just I mean, I was the same with lactation. I was always taught all you need is like a boob and a blanket, and all you need is like you'll know when to push. And
Yeah.
then the more I attended birth, I was like, no, actually that's not true. And we're really failing these moms because often they might run out of time or they'd push long and hard for many, many hours, creating broken blood vessels or broken
hmm
capillaries, or really pushing really forcefully into the abdomen, sometimes creating a diastasis, or if they had one, making it worse or pushing really forcefully down into the pelvic floor, sometimes sustaining unnecessary damage.
Yeah.
And the more that I was attending births, and also because I was teaching yoga, I had a women's class that I was teaching like in the mid 90s. And and I was teaching like in that women's class, women were coming where they were pregnant or postpartum or in perimenopause. And it was a really great class. So it was very mixed in terms of women. And some of my older women would share with me that they experience some type of pelvic pain. They might experience
Mm.
some leaking when they jumped or sneezed, or even a prolapse. And the more that I unpacked these stories with them, inevitably went back to their birth stories. And what I began to realize is that as we age and our bodies change, then sometimes those obstetric events from the past may catch up with us.
Mm.
And, or, I guess this happens when you, with your kids in the playground and someone hears you're a chiropractor, they'll be like, oh, let me tell you about.
Yes.
So, that's kind of what happened. Like I'd be in the playground with my kids and someone would
Yeah.
be, oh, you're a doula. Let me tell you about my birth. Or I'd be at a
Yeah.
dinner party and so, oh, you're a doula. Let me tell you about my birth. And
Yeah.
more often, they would be like these amazing, empowering birth stories that they just wanted to share to
Uh-huh.
someone that would get it. But more often than not, they would be about these disappointing birth
Yeah.
stories, right? Just or the, just some type of pain or symptoms that they're just living with. Um, and actually, these were the kind of stories that pushed me to create my class. Actually, it's called Push Empower because I want to empower moms, parents to be able to learn ahead of time, right? To push safely and effectively and protect the pelvic floor muscles ahead of time for birth.
Yes.
Because way back then, and this was just 4.5 years really into um, being a doula, and I've been a doula 23 years. This was, I would bring this up with some of the OBs and midwives that I worked with, like, why aren't we teaching our moms how to push better? And the answer that I would often get is that moms will figure it out on the day of,
Oh,
and then they only need to know it once because the next time is so much easier. And yes, while it's true, second time vaginal births are so much easier.
yeah.
But moms would often, as I say, push for hours and hours, maybe run out of time, need
Yeah.
episiotomy, forceps, vacuum, C-section. And yeah, that's how I got into it.
It's so
I became
fascinating.
obsessed.
Yes, of course. No, and I can hear your passion as well, and it's awesome. I think something that's so interesting about what you're saying is it's true that birth, breastfeeding, these are like among the most natural activities that can happen. But there's also a certain amount of preparation that needs to go into that. And I think sometimes in the natural health community, which, we're both a part of, there's like this assumption that, well, it's just going to unfold on its own and everything's going to be great. And that might work okay for some people. But we also live in ways that are very far removed from our ancestors and things aren't natural in the same way. And so for a lot of women, they find that their pelvis isn't open because they're having a desk job most of the day, or they're not walking around and moving their body. So there's so many things biomechanically, spiritually, emotionally that are not setting up that natural activity to unfold properly. So
Mhm.
I'm wondering if we can talk about just that intersection of it being natural, but also the importance of learning and having skills to go along with it. Because sometimes it would almost seem like those are two opposite things going in together, but in this instance, it seems like they pair very well together, the idea of birth skills with this.
Yeah, 100%. I'd love to hear from you, like what you've seen, and I can pick back on that too.
Yes, of course. Yeah, I
Because
mean,
you see pregnant moms too,
yeah,
don't
and
you?
yeah, oh yeah, a big part of our practice is pregnant moms, and we see a lot of moms have a very tight pelvis for one thing or another, whether they're just sitting most of the day, not moving around, holding a lot of stress and tension in their body.
Yeah.
There's a lot of reasons why, for one reason or another, baby's not descending down into the birth canal. I think culturally, a lot of moms are working very close up until their due date, which sets up some biomechanical challenges as well. And that's a whole nother conversation about, the
It's a
dynamics of
yeah,
that. But
absolutely, but yes.
there's
So
two.
no, but it's so important. I feel like,
Yeah,
where are you located?
we're in the south of Boston, so between Boston and the
Okay.
Cape. So yeah,
It-
SOB.
Yeah,
Right.
so I
Yeah.
find it a little bit different because during the pandemic I supported, there was a window where I was doing a lot of virtual doula work, and so I had clients like all over the country,
Hmm.
and also through my coaching, and I do sometimes see a different in terms of lifestyle. Like here on the East
Yes.
Coast, it's like go 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 go, and moms are like
Yeah.
really driven, pushing through, pushing themselves.
We see that
Um,
by us too. There's a lot of that in the Boston area, very hard driving, driven, focus, type A, a lot of that.
Which is great and it has its place,
100%.
but
Yeah.
for birth, there's a lot of the idea of not everything being so linear. Like birth is
Yeah.
not linear. And I feel like like I would have clients go, 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 like as you say, and then doing like spin classes 5 days a week. Or it was like,
Yep.
and so just that linear movement or sit in, a lot of sit in, and not so much of that emphasis on just like a nice variety of functional movement throughout the day,
Yes.
or like validating rest, like maybe out in the Midwest, it's like a little bit easier for
Yeah.
people to find rest. It's not in New York City.
Well, whenever we go to visit my family there in San Diego, we'll be out I mean, we're on vacation, but we're out in the middle of the week and it seems like all the trails are packed with people, the beaches are packed. And I think, does anybody work around here?
Yeah, right.
Everyone's just out having fun all the time.
Yeah, they're
Um,
in bed by 9 p.m. eating it.
yeah, yeah,
I know, it's watch a
there's something to
sunset.
that.
Yeah, yeah.
Yeah, there is something to that about learning to navigate and get in touch. And I know there's a lot of emphasis on particular types of athletics, and you probably see this when you mentioned functional movements. We see some moms that are very focused on continuing the same workout program that they've been doing, but that workout program might not be best suited for a pregnant body. And so trying to like shift and navigate into functional movements that are going to support optimal pelvic movement and health,
Yeah.
as an example.
Yeah, yeah, absolutely. I mean, that's like probably a whole conversation on
Yeah.
its own. But yeah,
Yes.
I'm just thinking, yes.
But yeah, you see your article. So to kind of connect the dots here, there's an article that's going to be in the current edition of the spring 2025 edition of Pathways magazine that's called Empowered Pushing. So that's part of why we're having this conversation. And you share several stories in it about ways that you were able to help some moms at the time tap more into the natural instincts they might have been having, or to help them push in an empowered way. So are you able to, do you remember some of those examples? Are you able to touch on some of those as well? Are you
Yeah,
okay?
and
We
if
can
not
talk
those
about some.
examples, I could
Okay.
probably pull some
Or if there's another
others.
example not from the article, that's great too. But where
Yeah.
something seems like it was going to go one way and that wasn't going to be towards an optimal labor and delivery, and then a few little bits of guidance can help it move in a different direction.
Yeah, well, let's like kind of like start at the beginning a little bit. Like, so often, what as a, birth doula, birth coach, childbirth educator, the number one question that I get asked, is often like, how am I going to get this baby out of my,
Yes.
how am I going to get the baby out? And so while I want to meet my clients where they're at, certainly, and validate their fears and acknowledge their validate their concerns and like acknowledge their fears, really, I want to reframe that question that everybody asks. How do I get the baby out? That it's not so much about how do we get the baby out, but how do we let the baby out?
Mm, yes.
And you can even just sense in your body, just with the language, right? When you just even hear that or say that to yourself, that when we think about getting the baby out, it kind of conjures up kind of mechanical, medical intervention, extraction.
Yeah.
And when we talk about letting the baby out, it's a process of welcoming. It's a process of working together with your baby. So it's a dyad, mom, baby together, working
Hmm.
together to let the baby out. Because I think sometimes moms forget,
Yes.
like they are working together. And that to really consider the baby as part of the process. It's not just the outcome, here's your baby, it's the part of the process, right? The whole through, you know, pregnancy, birth, postpartum, parenting, beyond. It's a process. That relationship shifts and changes as we go along, but it's a dyad.
Yes.
Um, so I like to start there in a way.
Hmm.
Um, and then help my clients and students understand that the baby has its own time sequenced physiological reflexes that it needs to express in order to navigate the pelvis, come into the pelvis, leave the pelvis, and birth itself.
Yes.
So how do we support that? Um,
Yeah, exactly. Well, and to your point of the terminology, that we could both feel ourselves relaxed when you said let the baby out versus get the baby out, or even push the baby out, implying these like very aggressive, intentional acts. There's some have suggested that changing the term from pushing to surges, or from a contraction to surge, or pushing to letting, that would be an interesting shift that way.
Mhm.
But there is a lot to be said about the language we have around these sort of activities. Yeah.
Yeah. Um, so yeah, so in when it and then going just back to the pelvis and the sitting culture that we, sit in, they say is the new smoking or whatever.
Right.
Like
Yeah, that is sad. Yeah.
we sit a lot, especially since the pandemic. I mean, it was before, but even
Yeah.
more so,
Yeah.
with so much of our Zoom and telehealth.
Yeah. 100%.
Yeah, so I mean, so looking at, because our postures and our movement and the way that we sit and the way that we move throughout our day matters. It's not just like maybe your hour of working out, then what do you do the rest of the day?
Well,
So
yeah, yep. Yep. To check that box that we did the workout, which is important. I support
yeah,
exercise. I
absolutely.
exercise a lot myself. It's super
Yeah,
important.
definitely
Um,
important.
but yeah, in terms of
About that.
if we can revisit a little bit of like the letting the baby out as well, we're talking about possibly some examples that you had seen in practice where there was almost the baby wasn't going to get let out, and then a provider comes in and basically like, well, I need to get the baby out, and you're asking, can we have a couple minutes? And then at that point, you can have a conversation, and even through just some gentle postural shifts or changes in movement or breath, something magical happens and the baby's able to come out of their own accord. And you'd mentioned that, no, we hadn't touched on that as well, some of the primitive reflexes as well, which that's another conversation as well. Those are so fascinating, all these amazing ingrained reflexes within the baby that are helping them to navigate down through the birth canal as well.
Yeah, absolutely. So I mean, often it happens like in different ways
Yeah,
many times. And I don't necessarily think that it's bad. Like I'm not knocking the OBs, but they're coming from a different perspective.
of
And so
course.
that's why I
Yeah.
think the whole team can be helpful because when you're standing really supporting both mom and baby's physiology, I think you have kind of different colored glasses necessarily than
Hmm.
say I've litigation like looking over my shoulder or you know
Right,
you know
right.
it's different. I mean anyway, but so for example, I think this is the story that I shared is that I had a client um and and she was pushing in the general like what a typical C curve position
Hmm.
that you'll often see. I mean, you'll see this at home births too, but like this happened to be in the hospital. And she was having an unmedicated birth. And as she started pushing, I noticed that her OB was looking at the heart rate monitor and looking at my client. And I could see just by observing her that, and also I could see the heart rate monitor, that she wasn't so comfortable with some of
Yeah.
those variables, those decels that were happening
Hmm.
with the baby's head in the birth
Yep.
canal.
Yep.
Um, and we had just completed the set of like, a pushing contraction, which generally is like three, pushes with a pushing contraction. And when that kind of went away, she turned to my client and she said, I know that you don't want an episiotomy, but this baby is not tolerating these contractions. And if the baby's not born soon, I'm going to need to cut you. I'm really sorry, but it's time. This baby needs to be born.
Yeah.
And my client like just threw me a look. And I knew she did not want an episiotomy. I also knew
Yes.
that we had been preparing, that her pelvic floor was really well prepared. And so I
Yes.
quickly said to her OB, and I said, can I have the next couple of pushes? Like, may I have the next? I just did a couple with my client, and she was like, yeah, absolutely. How can I help? And I said to my client, can you turn onto your side? And she was like, I
Mhm.
can't. I have a bowling ball between my legs
Yes.
because the baby was really quite low. So I said, well, we can help you if you want. And she was like, yes. So her OB and I actually like lifted her up and over, kind of scooted her up and over
Yep.
onto her
Yep.
side. So she was like more in a left lying lateral
Hmm.
position. And I said, can I just support this like right femur bone? So to bring it a little bit higher, because I wanted to
Hmm.
free that right sit bone and
Yep.
free that sacrum, right? That back door, give it a
Perfect.
little bit more
Yep.
movement.
Yep.
And on the next contraction, her baby rotated. It was so low down that you could see the top of its head kind of just turn
Wow.
and spiraling a little slowly. And then the next contraction, it spiraled a little bit more. And then the next contraction, it kind of just extended, crowned, and then the rest of the baby just slipped out
That's
with an
amazing.
intact perineum,
Wow.
no
That's
episiotomy,
amazing.
no scratch.
Yep.
And
It
this was
just
a big baby.
she just needed a postural shift, that was and yeah.
Yeah, she just needed a postural shift.
Yeah, that's amazing. When
Yeah.
uh when my wife was in labor for a second, we did home births with all three of our kids. The midwife and I both were looking in awe as baby was crowning and she was beginning to come out. We could see my wife's sacrum almost like rocking up and back in real time, and I've never seen that kind of movement on anyone we've worked at before. But also, I haven't had a chance to be up close and personal with an active delivery, and it was as she was coming out, we could see her sacrum start to rock and bend back and forth, and I was like, I didn't know that the sacrum could bend that way, but it turns out it can as baby's coming. And she was in a standing in a bent over posture with her legs open so it was allowing for optimal movement of the sacrum. Yep, exactly. And the thing was just
Yeah.
rocking up and back as baby was passing down through. It was incredible. I've never seen anything like
Yeah,
that.
I love it. Sometimes I'll have my hand on someone's back, lightly, not very firm,
Yeah,
and I can feel those movements under my hand,
it's
and it's
amazing.
just
Yep,
amazing.
yep, yep.
Yeah. But that's such a great position. I love the stand in and leaning
Yes.
forward, like stand and deliver.
Yeah, standing. Well, yeah, that's a powerful stance. And also if you
Yeah.
think about biomechanics, on your back is going to close down the that opening.
It
Sacrum
can,
folds itself
not
in.
always.
Yeah.
Sometimes babies will come whatever position you're in, but
Sure.
if
Yep,
but I
sure.
but that's the wonderful thing is like for the experienced people in the room, the baby gives you clues. The
Yes.
baby gives you clues. Like
Yep.
in the labor with a labor stool or its heart rate is going to tell you, okay,
Yeah.
mom, shift positions. Okay,
Yep.
mom,
Yep.
get off your back. Or,
Yep.
you might,
Exactly.
turn to the other side or
Yeah.
pick up a leg. Like if you're paying attention to the baby, I feel
Yeah.
like it talks to you in
Well, and,
different
and being
ways.
experienced in this work, you were able to identify that. And I think understanding that there are options is very important, and there's differences that can be done. It's not that like you must stay on your back and deliver, and if you can't deliver on your back, then we're just gonna cut the baby out or cut and force the baby out in that posture of like, well, let's try some options. But certainly that takes an experienced birth provider or someone who's an experienced birth doula like yourself to be able to understand the differences. And so a lot of that I think harkens back to making sure you've got the right team to support, the right team to support you going into it, to know that they're going to know some nuances to help out with that delivery.
And it's nuances. I
Yeah.
think it's, yeah,
Yeah.
absolutely. Yeah,
Yeah. Like maybe it would be
100%.
on her side, maybe it would be on all fours. We don't know. It could be standing and delivering. It could be a lot of different things.
100%.
Yeah.
100%. Sometimes it's just a quick um creative decision and going to the side. And if that hadn't worked, we would have done something else like
Yep.
quite quickly. But just go back to the sacrum because you probably see this in your work, and I see this with my clients, is that sacrum can get quite stiff.
Yes.
Um, and so having that body work to kind of find that
Yep.
mobility can be really helpful during the pregnancy. And that could be from
Yeah.
life, that could be from the pregnancy, the posture.
And we'll
Um,
we'll ask partners to come in to learn some sacral pressure and counter pressure, and we'll show them some hands-on techniques that they could do to help when their partner is in labor, just to help them through that. And it
mhm,
is interesting. Something I've observed is that early on in pregnancy, the sacrum, this is for a woman lying prone with pregnancy pillows, the sacrum will have a natural, what we call nutation, counter nutation, or rocking back and forth, basically, that it'll have. But as baby starts to get farther down, that rocking gets easier going into, let's see, with that sacrum coming out and the coccyx tucking in, whereas as
mhm.
we start to rock it forward again, it's going to have less movement that way as because baby's simply starting to occupy that space. So there's certain ranges of motion we start to notice are more normal and less normal as baby gets farther, as mom gets farther along and closer to delivery. And especially as we're getting into late third trimester when baby's really down in that pelvis, we're going to see very different motion happen. And so from our standpoint, we can sort of identify of like if we're not noticing this kind of motion, then baby might not be that far down. And are there some exercises or some things that mom could do to help get baby to drop down a bit?
Mhm.
You had mentioned some techniques or some things you might do with some of your clients. What are some of the things you might do to help them prepare their pelvis for labor and delivery?
Yeah, so there are things that we do, with the pelvis, and there are things that what we'll do, to support the pelvic floor as
Hmm.
well, leading up to it. So just another thing that I'll just mention, when it comes to the pelvic floor, because say the baby's coming down, like it passes through those ischial spines and it's coming down, it comes up against, say, the
Hmm.
pubic symphysis, and then it will flex back, right? It's going to flex,
Yes.
and it's able to move the sacrum and tailbone out of the way if given the opportunity before it will come into extension and kind of duck underneath the pubic bones, this
Yeah.
pubic symphysis. So what I often see, like in pregnancy, because of the distribution of the weight of the uterus and the baby, and you meant talking about it a little bit, is that we'd kind of turn the feet out a little bit and we come
Hmm.
into that posterior tilt, right, to be able to manage that distribution of weight.
Yeah, that makes sense.
But that just, if we think of that kind of sacred diamond, and then we have our anterior triangle in the front and that posterior triangle at the back, that posterior triangle gets quite tight because of that, just kind of walking around in external rotation, standing in
Uh-huh.
external rotation and kind of gripping there, because kind of the glutes and the hamstrings get a
Yep.
little weaker during
Yep.
the pregnancy. So if we kind of pay attention to that during the pregnancy, to spend more time, say, in some internal rotation, so that we can get to lengthen that posterior pelvic floor, taking the breath there, or some movements or some
Hmm.
exercises. We can talk more about that. Because if that posterior pelvic floor is able to progressively stretch and lengthen with the baby moving back, if it's tight, it gets quite rigid, and then that's when there's more stress anteriorly, where you get those little anterior tears. Ideally,
Yeah.
the baby is able to move back, lengthen that posterior triangle before it comes forward, right, to apply
That's,
that pressure.
uh-huh.
So one, we want to think about that, as well as that mobility in the pelvis. So depending
Yeah.
on certainly where they are in their pregnancy, but those last, say, 3, 4 weeks for primer, we are working on kind of rocking to kind of
Hmm.
encourage the babe
Hmm.
to kind of come into um, the pelvis. External rotation does open up the pelvis. So there is absolutely a place for that to help the baby descend in if you're wanting to do,
Yeah.
some deep squats or sitting cross-legged. But
Hmm.
we also want to be making sure that we are supporting the pelvic floor as well. So
Yeah, absolutely.
sitting, yeah, like in how do you call it? Like a virasana, but it would be like sitting. You could have some blocks underneath you with your shins right back. So
Yep.
not
Yep.
the W position, because that's really hard on the knees, but
No, but
if you're,
something like that. Yeah.
yeah,
Yeah.
sitting on your
Interesting.
shins, with the shins just with some support underneath you,
That's
almost if you
yeah,
had like a
it's fascinating.
meditation.
And
Yeah.
as you were walking through those examples, it's incredible all the different I mean, we know so little about the whole process, but what we do know that we can see so much wisdom that's if left unencumbered to function on its own in an ideal situation with the right support. I mean, there's so much wisdom that's unfolding there with the different movements and the way things rock and the reflexes of the baby to help them descend down even further. And this dance that's happening between the two is it's really quite incredible.
Yeah, it's amazing. It's extraordinary. I
Yeah,
love it.
incredible.
It's
Yeah,
so much
absolutely.
fun.
How many
Yeah.
births do you think you've been to at this point?
It's like around 1,000.
Wow.
Well, I'm about to do my taxes actually, so then I can count last
All right.
year's.
Yes.
But yeah, I kind of like, now I'll only count at the end of the year, like when I'm doing my
Sure.
taxes. I
Sure.
don't keep like a running number in
Yeah.
my head, but it's up there. I mean, when I first started, I was going to like 6 to 8 births a month for
Yeah.
years, and then like now, much later, I cut back a
Sure.
lot. I still attend
Yep.
a certain amount of births per year. It's not as much as I was doing,
Yeah. Yeah. That's
10,
incredible
15,
though,
20 years
to have
ago.
like been around that much birth. I mean, there's a lot of experience that's going to come with that and different wisdom from that.
You see a lot of different things, and what's been incredible about working in a place like New York City is there are so many different places of birth, and you get to see many different practices. And I've learned so much from
Yeah.
some of the midwives and the OBs that I've worked with, absolutely. And
Yeah.
even, and just sharing knowledge, has been so helpful. It's nice to see different things from different providers and different practices over the years, and
Yeah.
also to learn like, oh, this is possible, and that maybe not so, maybe not so
Yeah.
much.
I mean, even just the right techniques for certain things can make such a difference. Like that example that you gave earlier about having that mom go up onto her side to lift the leg up to open up the SI joint to allow the sacrum to rock back. I mean, that made all the difference for her for
Yeah,
that
and I
delivery.
remember once being with a midwife at a home birth actually, and my client was on hands and knees, and and it was like very, very strong at that point. Like the baby was
Yeah.
coming soon. It was a lot, and I had my hands on the back, so I could feel her sacrum, and it was like, and even the mom was saying to the midwife, just get it out. Like I just have done,
Yes.
and the midwife just gently said, okay, pick up your right leg. It was the right leg. Just pick up your right leg. So she was on hands and knees, leaning over. She was on her hands and knees in the water. And then she just picked up that right leg. So it was a little bit more asymmetric. And the baby just slipped out. It
Wow.
was amazing. Just that simple of picking up the foot.
Yeah.
Um, so I mean that taught me a lot as well, to keep in mind that it's not just symmetrical movements, it's asymmetrical movements. And
Yeah, that makes sense because, well, the baby's not coming down perfectly symmetrical. There's a torquing and a twisting that's happening, and so the asymmetrical movements would make so much sense because you'd get the pelvis moving one way on one side and the other way on the other side, which might just help to free baby up if they're having trouble passing a certain landmark in the birth canal or anything like that.
yeah.
And I
And that's
think,
why it's so helpful. And I'll just say, like, because
oh yeah,
I've used that idea, like I learned so much just in that one movement. It was like blew my mind. This was like years ago.
yeah,
And it could be the same with being hands, if you even stepping up, like I'll have a client and it might be like, okay, let's get up. And that movement of getting up or getting out of the tub or getting on the bed, or getting up and going to the, say the toilet, just that step up will suddenly just make a huge
yeah.
shift. So it's
A-
it's kind of powerful, that movement.
And you'll probably see some sense of moms intuitively moving around on their own in different ways to help, especially if this is a mom that's very in touch with her body to move around in certain ways that would almost create those same movements where that you're encouraging as well.
Yeah,
Yeah.
absolutely. Yeah.
And that's where I
That
think oh, go ahead.
That's another thing I think that's interesting. Okay, so it's kind of fun. Like, so often when you're, say, pushing in the hospital, the cues will be, they'll often say to the spouse or the partner to take their hand behind the mom's like upper back to support the head, that she's kind of looking towards her baby, right? And what I realize is often moms want to throw their head back and they want to arch, and
Oh,
they often like, no, 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 don't arch, like tuck.
yes.
And but then when I think about it, because the baby, right, it has to come into extension. So when it
Yes.
comes into extension, I feel like mom is coming into extension at the same time
Interesting.
that babies. So if I'm there, I will take my hand away. I'll motion to her, like take your hand, let her go back and
Right.
arch, because then sometimes what the baby needs to kind of extend
Yes.
underneath that pubic bone.
That, yeah.
So I'm looking at the mom like, what does she want to do? Because sometimes she can't articulate it,
Yep.
but she's doing it, and so I'll support that.
That's amazing. Yeah. And then it, she may go back to a rocking forward as well, and that's C-shaped as well, but that may come later in the process. And I think this harkens back to our the original question of this natural process combined with birth skills, right? We're like, yes, to be natural and unencumbered, but also if someone's not as in tune with their body or not connecting into the experience, they might not understand those. Like if a mom's totally unencumbered, has had a freely movable pelvis, is in touch with her body and able to, in an environment where she can freely express herself through the labor, then I think we would agree that the natural process would probably in most instances unfold just fine on its own. But if you subtract some of those variables, then you've got other things where having that extra help and assistance can be so valuable in the overall experience to have someone experienced to help guide them through that.
Yeah, absolutely. And you're talking about the polyvagal principles. I mean, so much. Look, there's so much fear around birth, and I understand there's so much uncertainty, and you hear all these
Yes.
stories, and maybe you've never gone through this before, and there can be a lot around that. And so that's why I think understanding the nervous system is so important, to
Mm.
be able to help the clients. Like, and this is in terms of the preparation where I spend so much on with my clients, is encouraging that embodied awareness, to develop that intuition, that interoception,
Yes.
ideally in pregnancy, so that you can kind of tune in and trust what your body needs to do. What does your
Yeah.
baby need to do? And then, because also when I think about it, if you're tensing up, guess what else is tensing up?
Yep.
So being able to have those strategies in place to be able to manage maybe the discomfort or some of those fears that may come up during labor, which are very real. Like I totally respect that and I get that, but we
Oh
want to
yeah.
have those tools
Yep.
ahead of time. Or if someone chooses the tool, say of an epidural to manage the pain, then we want to then be able to help them understand, okay, well, how do we still help the baby navigate through
Yeah.
the pelvis?
That's a
Because
whole
we
nother
still,
can of worms. We were just touching on that as well. I mean, that's why this is such a broad, incredible topic. I mean, that's a whole nother circumstances if there's a nervous system disconnect because of interventions like that.
yeah,
So
or you come with your nervous system, right? So you
yeah,
bring it to birth.
yeah, absolutely. Well, there's so much more we could talk about, Chantal. I really appreciate you joining me for this. Is there anything else that you'd like to share with our listeners? I mean, I feel like another conversation would probably be in order. I'd love to be able to talk about this again with you because this is so much
I'd be
fun.
happy to talk with
Yeah,
you again. This
okay.
has been fun. Part two. But
Part two, exactly. I
yeah,
mean,
the
especially if we
timing
can start
flew.
to connect maybe some of the polyvagal principles with that as well, because then that'll be really a really neat full circle. Um,
Yeah, I would be happy to do that. I think that whoever's listening, whether it's the pregnant moms or the spouses or the support people or the people that support pregnant moms through birth, is that um I really think it's important to listen to the mom, and
mm,
trust the mom. Sometimes so much of that is taken away during birth by the experts, and just to kind
yeah,
of give it back because we have this innate knowing and we need support. I'm not saying just the support to be able to do what you need to do to support your baby and birth your baby together, no matter what style or choice you decide. But I think it's really because so many times, like moms will have an instinct and it's shut down, but that instinct is strong. And
yeah.
you know, and sometimes you have to just kind of weed it out. Where's this coming from? Is it coming from a place of fear or is this coming from a place of knowing? And then maybe reframe it so that voice gets a little bit stronger. I just
Yeah,
think birth is so transformative. And if we can help moms can connect to that, it can be a very transforming experience.
that's beautifully said because that voice can be a very small voice, especially if it hasn't been honored and suppressed, then so it can be
Yeah.
hard to understand that voice. But um, yeah, how beautifully said to listen to that. In chiropractic, BJ Palmer, our developer, called that the wee voice within, but that little voice where it comes from a place of true knowing if it is honored, and that's something really to be listened to because that's the wisdom of nature coming through in human form. So
Yeah. And it translates into being a parent as well. We want to trust that voice.
yes,
Because,
yes,
some because that's another overwhelming experience. And sometimes we listen to the experts because we don't trust
yeah,
our
right.
voice.
It can be
And
overwhelming. So
yeah,
yeah, 100%. Beautifully
yeah.
said. Well, appreciate you again, Chantel. Thank you so much. All right, we'll
Pleasure.
tune in
Have a great
again later.
weekend.
Yeah, take care. Bye bye.
Bye.